This seminar is for educational purposes only. It is not a substitute for professional medical advice or treatment. Consult with your medical provider for medical advice or treatment. Although the presenters try to keep the information in this seminar as accurate and timely as possible, the speakers and Mather Hospital assume no duty to ensure the seminar is error-free. The speakers and Mather Hospital are not responsible or liable for any claim, loss, or damage resulting from you viewing this seminar.
Good afternoon, everybody, and thank you for joining us for today's HealthyU Webinar Series. Today's topic is the myths and reality of neck and back pain. At any time during the presentation, please enter any questions you may have using the Q&A feature at the bottom of your screen. We will answer as many questions as we can within the time allotted, and all of your questions will remain anonymous. Today's presenter is Dr. Ben Eliyahu. He has advanced certifications in sports injuries and pain management, and he is widely published on spine care in peer-reviewed journals and has made many clinical presentations on spine care in multiple conferences. He directs and coordinates the orthopedic and spine grand rounds at Mather Hospital, Northwell Health, and is a past member of the USA Olympic Medical Society, having been selected to spend a month in the U.S. Olympic Training Center, treating Olympic and USA elite athletes. Dr. Ben was in a private practice in Selden in New York for over 39 years. All right, Dr. Ben, I'll pass it over to you.
Thank you very much, Jonathan. So today's topic is talking about the myths and reality about back and neck pain, and also talking about some myths and dispelling some of those myths. Then I'll go into some of the things that you can do at home to take care of some issues that you may be having, and then talk a little bit about our program, and then take some questions and answers. So you'll notice there's a Q&A section on the bottom. So let's hold the questions to the end. I'll take a look at that Q&A section on the bottom. But during the seminar or webinar, if you have any questions, go ahead and type it in, and I'll take them at the end. So how prevalent is back pain in our society? Actually, it's a global problem. 85% of all individuals will have a problem with their back at some point in their lives. Actually, that number is actually growing closer to 90% now in 2024. It's 31 million Americans are experiencing back pain at any given moment. And when I said globally, there was a study that was published in a very prestigious journal called Lancet that talked about how back pain is the single leading cause of disability worldwide. And that has to do with global burden of diseases. The American Academy of Orthopedics actually said that 50% of all orthopedic problems are actually back related. The expenditures regarding back pain are they've exceeded 50 and are actually approaching $65 billion per year. And that's because not only are insurance companies spending money on back pain, but it has to do with occupational loss, lost time from work, and also money that the public actually pays for back pain treatment. So back pain is the #1 source of chronic pain in the United States. It's the most common cause of job-related disability. And interestingly, one of the equally important statistics that I really like to pay attention to is the rate of recurrence for back pain. It's 50% within 1 year and 60 to 80% within 2 years. Usually at this point in a live seminar, I'll usually ask the audience, what are their feelings or their thinking regarding why that statistic is the way it is. But since we can't have immediate feedback during this webinar, the reason why recurrence is so high is because nobody does anything to change it. So for example, you were raking leaves or you were shoveling snow, you hurt your back, and it went away and you didn't really do anything to change why that happened to you, or you're playing sports. So rates of recurrence typically occur due to perpetuating factors and risk factors such as being overweight, smoking cigarettes, not exercising, sitting on the couch all day, not moving, not eating right. And we're going to talk about some of these things. Posture is another one. So if you don't change something, it's the old saying, if you don't learn from history, you're doomed to repeat it. So it's the same thing with back pain. If you don't identify the risk factors, recurrence rates are very high. So you have to identify what those perpetuating or risk factors are, or what those particular situations are, and actually change it. And in some studies, it's as high as 80% within 2 years, which is kind of frustrating because it can be very painful. Next slide. So let's talk about some common myths and facts. So ordinarily, when I do this in person, I'd say I wouldn't show you the answer, but Back pain is always due to injury or serious disease. The answer is no, that's false. Lack of exercise allows muscles to get weaker and atrophy and get very unsupportive of, in this case, the spine. Prolonged sitting. Sitting has been defined as the you smoking. Poor posture. If you're not sitting straight and you're leaning forward and your head is forward, for every 2 inches your head moves forward over your spine, that actually causes about a 20-pound increase into your neck and into your spine. And then poor lifestyle habits. We'll talk more about these in detail. Next one. So bed rest is best for acute back pain. Your back hurts, just get in bed and stay there. Well, probably 25 years ago, that was the common advice given to you by your primary care physician. Exactly the opposite is true. Bed rest actually promotes more back pain. Motion and exercise is considered medicine for your back. And here's the major reason why, and I'll get into this in a little more detail, but when you're laying in bed all day, or days or weeks at a time, your muscles start to atrophy, they get smaller, they get weaker, and it actually allows less support of the joint, it creates more inflammation, and it actually perpetuates pain. Next slide. So if your back hurts, exercise more. Well, this is counterintuitive. If you're in pain, you would think that, oh my God, if I start exercising, if I start walking or get on a bike, I start doing some TheraBands and whatever exercise you try and talk about, you might think that, oh no, that'll make me worse. And in the old days, doctors used to say, no exercise, do not exercise, just lay in bed. Well, the actual answer is it's the opposite. Exercise is medicine, so it is true. Core exercise, and we'll talk about that, is critical for a healthy spine. Lack of exercise, like I said, leads to atrophy and decreased spinal support. And aerobic exercise is actually very good for the joints and muscles, let alone your heart and cardiovascular system. You could take a look, if some of you have had MRIs, I want you to take a quick look. I use this in clinical practice. We talk about this in our back and neck pain center all the time when we get MRI scans. Now, I don't expect you to become a radiologist, but you could probably see that in the normal picture, and this is a cross-section cut, looking through you like this and then down. So basically, we're not looking at a side view, we're looking at a cross-cut view, kind of like a banana that you slice and look down at it. So notice the normal picture where you can see all the black muscles on the bottom part of the picture, that's healthy muscle. As we start to move to mild, moderate, and severe, you see a lot of infiltration of that black space, which is normal muscle density, and you can see a lot of white stuff infiltrating and making that black stuff go away. That's all fat. So fat has infiltrated the muscle because the muscle has atrophied and disappeared, and you can kind of put 2 and 2 together, and if that muscle is gone, the spine doesn't have a chance of being supported properly. Next slide. So core strength and stability of the spine. So there are different kinds of things that you can do. And this is all based on, when we make recommendations for core stability exercises, of course, we take into account your age, what kind of shape you're in, have you not exercised at all? What are your capabilities? What can you do? What can't you do? So aerobic exercise, in easiest to greatest, obviously walking would be the easiest, and everybody can walk. Walking has a significant impact on increasing strength in bones, increasing muscle strength, decreasing body fat. It's good for your cardiovascular health. It helps to make your mood better. It decreases anxiety and depression. And it also helps to increase balance and coordination. So walking, by all means, is something everybody can do. Now, if you have a medical problem like heart disease or peripheral arterial disease, a vascular disease, obviously you need to talk to your own personal doctor about this. But walking is very simple. And then we go up the scale to swimming and cycling. Swimming is one of the best exercises for your back. And even if you can't swim aerobically by doing laps, you can certainly get into a pool if you have access to an indoor pool and actually do like calisthenic type of stretching and exercise, because the water creates resistance. And the second part of that is the water actually creates buoyance. So you are 80% less weight when you're in water. Makes it a lot easier to exercise your joints and to get the muscles stronger. For core stability, we have a bunch of pictures here. You can see from left to right on the top picture, he's doing a bent arm plank. That's very easy to do. If you have elbow problems and shoulder problems, probably not a good idea to do. The one on the middle, the core exercise, is called the dead bug. You can lay on your back in bed and do this one. This is really good for strengthening hip flexors, your abdominal muscles, as well as your upper back muscles. The side plank one, a little more difficult, but it's doable as long as you don't have shoulder issues. That helps to strengthen the core muscles or your back muscles in the side, the deep multifidi muscles, if you will. Bottom left, that's a bridge, very good for strengthening your core, and so on and so forth. You can see the last one on the right on the bottom. He's actually sitting in a chair, something easy to do. And just by lifting his legs, you can actually help increase your hip flexor strength, but also increase your abdominal strength and thereby your core strength. You could even make a variation of that, where as you can see the man is lifting up his left leg, he could take his right elbow like this and meet it towards his leg. That actually creates a little bit of a crunch, like an abdominal exercise. And it's really good for improving not just back strength and core strength, but also posture as well. Next slide. So here's another myth. What you eat has no effect on your back or your health. Well, I think by now everybody knows this is false. So you could see the man on the left, he's kind of obese, not kind of, he is obese. And the woman on the right, she's about to eat a donut. So what we're saying is what you eat matters. So a healthy diet is extremely important, particularly a diet that's anti-inflammatory versus pro-inflammatory. And just for brevity's sake right now, I'll go into more detail on diet, but a diet high in sugar and processed fats are very high inflammatory components and can increase not just back and neck pain, but joint pain as well, let alone having cardiovascular effects on your heart and your arterial system. It helps you maintain a healthy weight and BMI. And most importantly, in our discussion for today, it helps to decrease spine pain. Next slide. So let's talk about the role of diet and nutrition. In a live seminar, I'd ask you, okay, which picture, left or right, do you think is better for your health? And most people would obviously point to the picture on your reading right. So if you look at the picture on your left, there's processed cheeses, there's processed meats, high unquality foods on that picture. Now, don't get me wrong. I'm not saying you can't have that periodically. You can, but you can't make that your staple in your diet every day, 24/7, 365 days a year. That will lead to all kinds of health problems, and not just heart, but also your joints and your spine. Take a look at the picture on the right, and you can see a lot of colorful foods there: produce, vegetables, fruits. That's called eating the rainbow. Those are pro-inflammatory foods. I'm sorry, anti-inflammatory foods. The picture on your left are pro-inflammatory foods. And I'm sure most of you, if you think back to when you've eaten foods that look a lot like the diet on the left, there are times you wake up the next day and your joints are kind of more achy. You don't really know why. You didn't really do anything from an activity perspective as to, lifting or doing work around the house or raking leaves that would have made that pain occur. Yet it may be very well that what you ate the day before was now processed and it created an inflammatory response in your body, and now you're achy more. When you eat a very high anti-inflammatory diet, which we'll go into, as you can see, it's very colorful, high in produce, much, much healthier, and decreases inflammation. Next slide. So here's a little more on the anti-inflammatory diet. Excuse me, notice the picture on the left where it says Mediterranean diet. About 15 years ago, Spain did a study, started a study. It was going to be a 10-year longitudinal study looking at people that they put on the Mediterranean diet, and they wanted to see what happened to those people. Did they become healthier? They actually stopped that study 4 years in, and normally I'd ask people why at this point, but because it's a webinar, I'll just tell you. It's because that after 4 years, the results were so astoundingly in favor, health-wise, of the Mediterranean diet, there was no point in going on 10 years. People were coming off their blood pressure medications. They were coming off their diabetic medications. They stopped taking ibuprofen and anti-inflammatory drugs, and they were losing weight. So the bottom line is this type of a diet not only creates decreased inflammation, but also helps to make you healthier. It helps to get rid of diabetes and high blood pressure, helps you lose weight. So it's not an easy diet to get used to, especially when you're used to the other way, but it is extremely, extremely effective. So pro-inflammatory foods that trigger inflammation, eating red meat every day, eating high trans fats, hydrogenated oils that you buy in your baked goods and crackers, eating a diet high in omega-6 fatty acids instead of omega-3 fatty acids. Difference being omega-6 is such things as corn flour, soybean oil, sunflower oil, and then a diet high in sugar, simple carbohydrates like table sugar, like donuts you saw on the previous slide, cakes and ice creams. Again, I'm not saying you can't have that. I'm just saying if you look at the pyramid at the left picture, you can see that it's very top of the pyramid. It's not the bottom where it's the staple of your everyday 24/7 diet. Meats and sweets are at the very tip. You can have it periodically, but periodically is the key. Moderation is always the key in anything. Anti-inflammatory foods, omega-3 fatty acids, basically canola oil, walnuts, things like you'll have in fish, fatty fish like salmon, sardines. Those things are extremely healthy and anti-inflammatory. Extra virgin olive oil, extremely anti-inflammatory, as are things like avocado, walnuts, fruits and vegetables. Eating the rainbow is the ticket. And then herbs and spices, things like ginger, curcumin, turmeric. Those are all really high anti-inflammatory spices and herbs. That's very easy to add into your diet. And also by adding it into your diet, you can put it in yogurt, you can put it in your cereal, you can actually cook with it. Next slide. So my lifestyle has no effect on my back, or it has a significant effect on my back. So the answer is your lifestyle has a major effect on your back. Exercise, posture, what you eat, your activity level, extremely important. Next slide. So lifestyle tips for a healthy spine. Lifting and bending properly. Bending from your knees, not lifting by bending over. Sleeping well, getting a great night's sleep, good mattress, good pillow. Maintaining good posture. Sitting straight, not slouching. That goes for standing as well. The more you slouch, the more negative pressure you put on your joints. Don't sitting too long. I refer to sitting as the new smoking. Especially when COVID happened, everybody was at home and working from home. And if you weren't working from home, you were surfing the internet or just watching TV or looking at things on your computer all day long. And you sat all day for hours on end without getting up and slouching. And all that mechanical stress put tremendous negative effects on your joints and muscles of your spine. Your shoes even make a difference. If you wear shoes that have low heels without proper arch support, that can affect your whole body mechanics as well. Not exercising, we talked about. Smoking, I'm not going to beat that, but the bottom line is smoking has an effect not just on your lungs and heart, has an effect on your stomach, but most importantly from a spine and joint perspective, it actually decreases circulation to your spine joints and to your discs of your spine, and therefore there's less circulation, so therefore you can't really heal, and it actually promotes degenerative changes. In fact, there's research now that spine surgeons, if someone needed spine surgery and they're a smoker, they tend not to want to operate on those people because the outcomes on spine surgery for people who are smokers is not very good. So there's no sense operating if they know that they're handcuffed from getting a good outcome. Stress, another one. You have to learn how to recognize and manage stress in your life. Nobody can get rid of stress. Stress happens from the moment we're born until we die. It's just a matter of how you manage that stress, whether it's deep breathing, whether it's exercise, going to massage, doing Tai Chi, like you can see in that middle picture. The bottom right picture, you can see she's doing yoga. That's a great way to manage stress and anxiety. It's also good for your spine. We talked about maintaining healthy weight, staying hydrated. You should be drinking probably about 64 ounces of water a day. Your body really, really needs hydration, especially your spine joints and your orthopedic joints. And then paying attention to any warning signs that you experience, like pain or inflammation or numbness or weakness. Next slide. So posture, we kind of touched on that. So poor posture does not cause any increased back or neck pain. The answer here is clearly false. You could see that a good posture, conversely to a forward head and neck posture, on your far left picture, you can see how his head is forward, his upper back has been curved forward. And then as we progress from left to right, you can see that the spine in the lower back area is causing actual mechanical changes in the way the spine works, causes weakened muscles, causes muscles that become extremely tight in some area. We call this a cross syndrome. Not important for today's discussion, but you can see that posture absolutely affects your neck and back. Next slide. Smartphones, how about that? So look at the guy looking at his phone and texting. So there's actually a new medical condition called text neck, and that's because when you're texting all day long, you tend to be on your smartphone or your smart device. So you're on it, but instead your head is down and you're constantly, your shoulders are forward, your head is down, and you're just typing away. That puts a lot of pressure on your neck and your upper back. Now take a look at that picture on the right where you can see the actual pounds. So your normal posture on your far left, you can see that's only about 12 pounds of weight on your neck. 2 inches forward, which is about this far, which probably is for most people who are just slouching, that adds an additional 20 pounds to your neck. That's 32 pounds of pressure. So that's like taking a 20-pound suitcase and throwing it on your head and walking around all day with it. Imagine that. Imagine taking a bag with 20 pounds of weight, putting it on your head, and me asking you to do that all day long, all week long. I think within probably 3 days, your neck will be killing you. Now, if that neck actually goes forward about 4 inches, and you probably have seen people like this, as we get older, some older people actually look like this because they haven't taken care of it over the years. And I've seen these people in clinical practice, and they have significant amounts of neck pain and upper back pain and have developed severe amounts of arthritis to the point where they have spinal stenosis. So, and that's not correctable. And once your posture becomes like that as you get much older, it's really not correctable. So the obvious thing to do right now is, if you're younger, is change your behavior, learn how to change your posture, be cognizant of your posture, and make sure that that far right picture never happens to you. You can see also back to the left picture in blue that posture has effect not just on your spine, it also has an effect on your lungs, it has an effect on other joints as well as your eyes. Next slide. Always use heat if your neck hurts. Well, that's false. So if you were to sprain your ankle or to sprain your knee, most people would say to me, oh yeah, no, I'll put ice on it for the first 24 hours. So your neck and back is no different. If you have an acute or a new injury, always ice for 24 to 48 hours. I always tell patients 48 hours is a good rule of thumb. However, in chronic stages of an issue, your muscles tend to get tighter and it becomes stiffer. So heat is generally better. Now, not dry heat. This person that you see laying there is using a dry heating pad. It needs to be a moist heating pad. Dry heat doesn't conduct through the skin down into the deeper tissues. However, if it's wet, it'll conduct deeper. So always use moist heat. Now, there's nothing absolute in life. Some people use ice and they get stiffer afterwards. So if that's you, you would try heat instead of the ice. But as a cardinal rule, always ice for the first 48 hours and then switch to moist heat. Next slide. Back pain, yeah, that just happens because I'm getting old. Well, it's partially true. We definitely get wear and tear as we get older. But as a general rule, I've treated a lot of people with back pain who were in their teen years, in their 20s, 30s, and 40s. It's not just a linear factor of age. It has to do a lot of what we just talked about: lifestyles, exercise, how much you sit, eating a good diet, and maintaining good posture. Next slide. People who do hard physical labor, they're the ones that are most likely only to get back pain. Also false. If you're sitting in a desk all day, it's not just the blue collar people that get back pain. It's pretty much, like I said in the beginning, 85 to 90% of our population gets back pain at some point in their lives. So no, it's not just people who do physical labor. People who sit a lot are at equal risk, because I said sitting is the new smoking. So one thing that you can do if you sit a lot is notice that the guy on the bottom right, he's actually using a desk, a standing desk. So standing while you're working is a good idea. And sometimes some companies will allow you to get that, as well as good ergonomic chairs that provide much better posture while you're seated. Next slide. So we talked about sitting. So here's some tips. As I talked to you before, sitting increases neck muscles to get tighter. Your trapezius muscles, the discs actually increase pressure by 6-fold. So if there's normally about I think a 12 to 15 millimeter mercury pressure inside a normal disc, when you sit, that increases by 6 times, upwards of 60 to 80 pounds per square inch. Your hips become weaker and tighter. Knee pain develops. Sciatica can develop. So sitting is really not good for you. And yes, if we work and we have to sit all day, there's nothing you can do about it. You have to sit, but you can certainly stand up, take breaks, take walking breaks, stand up and stretch, or even look into a standing desk. So some tips of how to sit: make sure that your feet are flat on the ground. Sometimes I tell patients, why don't you get like a step box and put it under your feet, because with a step box under your feet, it actually forces you to become more erect in your chair. Put a pillow behind your back to maintain that proper lordotic curve that we all have in our back. And sometimes that helps you to sit much better. Bring the chair in closer to your desk so you're nice and erect, and just be cognizant that you're not doing this while you're working. Next slide. Mattresses, it doesn't matter what kind of mattress I have, it has no effect on my back. I think most people know that this is not true due to media advertising of the different mattresses that you see advertised on television, things like, I think the air number bed, Tempur-Pedic beds. So the bottom line is, I don't really particularly care what kind of mattress you sleep on. I'm not going to advocate one or the other. I'm just going to say to you that mattresses do matter. And too firm a mattress is not good for you. Too soft a mattress, also not good for you if you're sagging. The way to tell is if you look at the person on the bottom picture, notice how they're laying on their side and that their hip has kind of sunk in a little bit, but the mattress comes up and supports them, and the same thing happens by the shoulder. If I drew a line, you can see the stippled line there. Their spine is perfectly straight. Now compare that to the mattress that's too soft, top left, compared to the mattress that's too hard, and notice that what that spine angle does. It puts a lot of stress during the night. So I don't care what mattress you use, as long as it produces that bottom effect, which is just right, a nice straight spine while you're sleeping. Next slide. Your mental health has absolutely no effect on your back. That's false. Your mental health has tremendous effect on your back. There's a huge mind-body connection. Chronic pain leads to anxiety and depression, leads to sleep disturbances, and perpetuates back pain. There's a very strong connection between back pain and how your head goes. So if you're experiencing anxiety and depression, you don't handle that one way or the other, it's going to perpetuate your back pain. Long story short, England did a lot of research on this because they're basically a country that relies on social medicine, and they found out the hard way that they were spending tons of money on interventions and it just didn't work until they realized and identified those patients who had anxiety and depression, and they taught them how to manage it. Things like yoga, things like deep breathing, meditation, Tai Chi, and even going to a psychologist for things like cognitive behavioral therapy. England found that that was extremely helpful. And in their case, they were interested in not just helping their patients, but also saving money. Next slide. So how does anxiety and stress cause issues? Well, you can kind of surmise that pain leads to muscle guarding, muscle tightness leads to restricted range of motion, leads to atrophy, and now decreased function. So your activity levels decrease. So essentially, when your activity levels have decreased and you've become a couch potato and you're watching TV and not functioning, it just perpetuates the whole problem. Additionally, you can't do the things that you love to do, whether it's hobbies, whether it's sports, whether it's just playing with your grandkids. So as a result, you become depressed because you just have no function in your life anymore, and you just can't do the things you love to do. You become anxious and depressed. So the more you become anxious and depressed, the more you want to lay around. The more you lay around, the more you become anxious and depressed. And you can see the vicious cycle. And there goes the pain and the mind-body cycle. Excuse me. Next slide. So how do you minimize stress? Well, you set a schedule, eat a healthy diet, exercise regularly, sleep better, start doing breathing and meditation, go to a yoga class online, go to a yoga class in your community, get massage therapy, Tai Chi. Any of these really work really well. The research is pretty good on yoga and deep breathing meditation and exercise. I recommend those. But you can use things like body scan meditation, like we show you here in this slide, where you just take deep breaths and focus on feeling relaxation in your body. There are classes online that you can do. If you have anxiety and depression and back pain, they're related and you need to handle both. Next slide. So real quickly, let's just talk about some things that actually perpetuate or cause back pain. From an anatomical perspective, obviously on the top left, spine joints that become arthritic or stuck or misaligned, they can cause pain. Nerve pain, things like sciatica. Most people experience sciatica. The sciatic nerve is the big nerve that goes down the leg. It's the red stippled area. Usually it happens from a pinched nerve, such as that can occur in a herniated or a bulging disc. The picture in the middle next to the sciatica, you can see a bulging disc. The disc material is actually moved from the middle. I like to use the analogy of a jelly donut. So a jelly donut, normal jelly sits in the middle of the donut. When the dough moves from the side out to the, when the jelly moves from the middle out to the side, it can actually, like you see in this picture, get very close to that nerve, and that can cause sciatica. Another thing called piriformis syndrome happens to people who are runners, who sit all day. That little muscle that it's pointing to becomes very knotted up. And look where that muscle is. It sits right on top of the sciatic nerve. That can actually cause sciatica as well. And then on the bottom left, you can see something called the sacroiliac joint, which is in your pelvis. This is probably one of the most uncommon causes, unidentified causes of back pain, probably upwards of 30–35% of the time in mechanical back pain. Very commonly seen in women who are pregnant, in people who are obese, in people who have had spine surgery, infusions. It puts a lot of stress on that joint and can cause back pain. And not just back pain, it can cause pain in the buttock and even sometimes into the leg. Very oftentimes overlooked, not treated at all, and people have chronic pain as a result. Next slide. So some conservative, non-invasive treatment options, physical therapy, chiropractic care, yoga, acupuncture. You can see on the top right picture, acupuncture has been shown to help relieve back pain as well. Yoga, extremely good in the literature. We'll talk more about some of these in a minute. Next slide. So my training, I was in practice for about 40 years as a chiropractic physician. I've recently just taken on the role of administrative director of our back and neck pain spine center at the hospital. And I'm just going to talk a little bit about modern day chiropractic treatment. So what do chiropractors do? Basically, good chiropractors limit their care and their treatment to the back and neck and joints. They don't prescribe drugs. They do very comprehensive patient examinations, order x-rays and MRIs and CAT scans, and come up with a treatment plan. And recently, a lot of societies and a lot of organizations, including the AMA, the FDA, the CDC, the Joint Commission, the American College of Family Physicians, have actually said that this type of treatment, spinal manipulative therapy, should be as a first-line approach for neck and back pain. Next slide. So what types of things do chiropractors do? I'm sure some of you have been to a chiropractor. The main thing that are associated with chiropractors is joint manipulation or the back and neck cracking. Just for edification, the cracking that you hear, nothing cracks, nothing breaks. It's simply just gas that's released from the joint as the joint is stretched. It's extremely safe. It's very efficacious. Its main goal is to just restore normal biomechanical motion and alignment to joints that are malaligned or not moving properly. Is it good for everyone? Clearly, the answer is no. Some people it's great for. Some people who have rheumatoid arthritis, have osteoporosis, have any history of cancers, those are things that are not really a good idea to get your spinal manipulation for. But as I'll say, there's no reason you still can't go to a chiropractor because there's so many things that chiropractors do that aren't manipulation related. Things like a Cox table, which I'll talk about, physiotherapy modalities, much like physical therapists do, exercise rehabilitation, doing traction modalities like muscle work, myofascial release, teaching people core stability exercises and about posture and nutritional advice. Next slide. So this is the Cox table that I primarily used, especially in patients who were not good candidates to get the cracking or the joint manipulation I just referred to. This table simply moved up and down and moved the patient in and the joints and the discs in different directions. Actually published a study. Make a long story short, if you look at the bottom right, you can see that the disc, which is sticking out in that red circle into that big white space, was no longer visible after a few months of care. And the post-treatment MRI actually showed that the disc got better. So this is a very effective treatment technique, and it's good for the spine. The gentleman that's actually treating on the top left is stretching the discs and the joints in the lower back by holding the lower back. The top right actually holding the neck and moving the right hand up and down, stretching and putting a tractional force into the joints and discs. Very effective, very safe, and in my opinion, almost as effective as regular joint manipulation for populations of patients that can tolerate it. Next slide. So the physical therapist that usually talks today was unable to attend, so I'm going to talk about our PT department at the hospital and physical therapy in general. So physical therapy, some of you may have been to physical therapists. Physical therapists primarily rely on teaching you how to prevent the progression of conditions such as spine pain. They talk to you about posture, about strength, balance, and teach you exercises necessary to strengthen the spine joints that have become weakened and atrophied. Next slide. So what does a forward physical therapist do? Well, like a chiropractor, they'll evaluate you first. They'll look at your ranges of motion. They look at your strength, gauge your strength of your core and your postural muscles. look at you while you're sitting and standing, your posture to help guide you in better posture, and then teach you how to do functional activities that are either sports specific or work specific. Next slide. Like chiropractors, they teach you stretching, strengthening. They teach you how to restabilize and re-strengthen your core. They'll do manual therapy. They also do modalities like ice, heat, electric stimulation, and functional activities. And you can see from the picture, that's a picture of our physical therapy room. As you'd expect, there's all kinds of equipment there, treadmills, bikes, steppers, as well as hands-on treatment that our physical therapists do. Next slide. One of the things that makes our department different is something called the McKenzie method. The McKenzie method, we have 2 or 3 certified McKenzie therapists. It's a worldwide therapy that's based on finding the position that decreases patients' pain the most. It's called the directional preference. So for example, if you had sciatica that goes down your left leg, and we bend you backwards and that sciatica pain gets better, that would be considered an extension bias. Your extension relieves your pain. Conversely, if you went forward and it relieves your pain, that's a flexion bias. So we identify which position tends to reduce your pain the most, and that's the position we actually teach you how to do certain movements and exercises, not only with us, so we get your pain better, but also to teach you how to do on your own should the problem come back and recur later on. Next slide. So a little bit about our spine center at the hospital. It's run I run the program, but the nurse practitioner who is very, very, very experienced and really, really great at what she does. She does the examinations and she does our triage and navigation, but we take a stepped approach. So a stepped approach means we're always going to start with the most conservative, least invasive care first. And that would usually be a chiropractor, physical therapist, something like that. And then if it doesn't get better, we'll move up the ladder to a neurologist, orthopedist, or a pain management physician. Patients sometimes need injections like epidurals, facet blocks, and then lastly, spine surgeons. So if a patient comes and sees us, we don't always start on the bottom. If the person is miserable and they've already been to a physical therapist and maybe to a chiropractor, or they're in so much pain they just can't start there, we'll go right up the ladder higher so we get to the point where we can go back down to do some core strengthening and maybe go to a physical therapist after. So in other words, if you have a raging sciatica that's 10 out of 10, you can't sleep, you can't function, yeah, we're going to go to a pain management physician first, maybe consider an epidural injection. And once your pain is relieved, then go back down to a physical therapist to start getting your core strengthened and to start getting you in better posture and help you get stronger to prevent recurrence. In our program, the breakdown is about 75% get better with the bottom rung of that ladder, 20 to 23% get better with seeing a pain management physician or an interventional neurologist or radiologist. And only 2 to 3% of our patients ever require surgery. And that's because we're so effective of identifying the problem, triaging the patient to the right provider at the right time, and then getting the patient to get a good outcome. And along the way, we inject some of those support issues that our nurse practitioner teaches you about, kind of things that we talked about, teaching you how to do the mind-body connection and how to do some of that meditation, how to change your diet, as well as getting you to do more core strengthening and more exercise and becoming more active in your life. And a better lifestyle, as I said, leads to better, healthy spine. Next slide. So as I said, it's a multidisciplinary approach. We have a team approach. We have all the providers that we talked about. Our goal is to reduce your pain, improve your function. We don't use high-risk pain medications, so we're not prescribers for opioids because research has clearly shown they don't fix the problem. We want to get to the root cause, and we want to work with people that want to get to the root cause, to get better, to finally get better and get on the road to a healthy life again. And we do that by addressing risk factors as well. Remember, I talked about in the beginning that if you don't address the risk and perpetuating factors for back pain, history will only repeat itself. And our job is to help you identify what those risk factors are, what those perpetuating factors are, identify them. And that could even be medical comorbidities. Some people didn't even know they had diabetes or had hypertension or had some other medical problems that kind of led to spinal disease and perpetuated spinal disease. If you're a smoker, we get you in the right direction of trying to quit smoking with our programs throughout Northwell. Next slide. So in conclusion, it's important for you to know the facts. I've given you some tools that you can certainly take home from today's talk to increase your lifestyle, make it better. and help reduce your pain. Things like knowing that exercise is medicine, sit less, get up, move more, work on your posture. I've shown you what good and bad posture looks like. What you eat makes a huge difference. I've given you some hints and tools on how to make your diet better. And I've given you some tools on how to reduce your stress. And I've demonstrated to you that stress and anxiety and depression are perpetuating factors for back pain. If you know you have anxiety, if you know you have some depression, it's probably one of the reasons why you still have back pain. Not the only reason. There are mechanical, anatomical reasons like we talked about. There are lifestyle reasons, and certainly stress is one of them as well that needs to be managed. If you have pain that is not improving, there is help. Our program has been around for 8 to 10 years, and we're extremely successful in helping people get better. And we have great outcomes because we take a team approach, a multidisciplinary approach to helping you achieve the goals that include not just pain relief, but also improving the function and quality of your life. Quality of life, that's our goal. Help you get more quality of life by reducing pain and improving function. Next slide. So on the bottom, there's a Q&A area. I'll give you a minute to go ahead and type those in. If you have any questions, you can certainly email me at that email address. If you'd like to make an appointment to see us, we take pretty much every insurance company, and we're happy to help you. And you could just jot down that phone number, give us a call, and we're happy to help.
Awesome. Thank you so much, Dr. Ben, for your presentation.
So you can see on the bottom, talking about exercise. This is oftentimes what happens. People buy a bike or buy some sort of exercise equipment, and it turns out after about a month, the only exercise they get is by dusting it once a week. That doesn't cut it. So if you're going to buy and invest in a piece of equipment, I would recommend highly that you get on it and use it. There are some people that have treadmills that they put in front of their desk and actually use the treadmill while they're working to actually do exercise at the same time. You could even do that with a recumbent bicycle. I prefer recumbent bikes versus seated bikes like this. Let's see, any questions?
Yes. So it looks like we have one question, Dr. Ben. And
So
also for everybody,
I'm sorry?
no, I was just going to say for everybody, just a reminder that all your questions will remain anonymous to protect your privacy. So yeah, if you have any questions, enter them in the Q&A feature at the bottom of your screen.
Okay, so this says I'm having scoliosis and arthritis in my back, hip and knee and ankle, all on my right side. I'll have to see at least 2 different doctors. Do you have an opinion on a timeline for which diagnostic test I should do first? Well, that is a great question. And this goes to the chicken and the egg. It comes down to which is the most disabling and which one did you have first. So if you've had chronic back pain first for a very long time, and then you developed hip and knee pain, which is very common, I would start with getting your spine looked at first, because sometimes that can perpetuate hip and knee issues because your gait has been altered, the muscles have become weaker. Conversely, if your hip pain or your knee pain was first and you've had it for 5 years and all of a sudden you develop back pain secondarily, well, that's true too. Having a knee or hip problem for a long time alters your gait, creates muscle atrophy, alters the kinetic posture of your spine, and can now cause back issues. So the bottom line is, and I'm obviously biased, I would say go to someone who has a handle on all. So your choice is you can go see a spine doc first, or you can go see a general orthopedist first. So why not see someone who has a handle on being able to identify the right pain generator from the get-go? In my opinion, that's my nurse practitioner. She's extremely adept at doing it, and I think seeing her would be a great idea. Hope that answers the question. Next question. I've been to Mather Hospital and was evaluated by Caitlin. She wrote my prescription for BT. It expired. I have a problem with my left leg going up and down the stairs. Is it my back where I have constant lower back pain? I have rheumatoid. I would rather go to a chiropractor. So the question here is, that's fine. And if you haven't spoken to Caitlin, I'll certainly mention to her your question, and maybe I'll have her reach out to you. And we have vetted probably about 15 chiropractors in a 10-mile radius of the hospital. I personally have screened as well, that I know practice similar to the philosophy I gave you when I spoke. And we can help you get to the right chiropractor near your home. So I'll talk to Caitlin about this, and we'll get back to you. Let me just jot your name down. Hopefully that answered your question, but we'll handle it. Next question was, during rounds of golf, my front nine are pain-free, my back nine on my right side near my right hip. Um, that's a tough question. I'm a golfer, so I know exactly what you're talking about. And typically, I don't know, maybe you can just type it in. Are you riding or are you walking? Are you walking 18? Are you riding 18? So I'll just kind of answer from a general perspective. Typically, the first nine, when you're playing, it probably is not putting a tremendous strain. If you're walking, I'm going to assume you're walking. If you're walking, it's not putting a tremendous strain on your spine. Remember, golf is, if you're turning properly, and then you're in your backswing, and then your downswing, as you're coming down and turning, you're activating a lot of your side back muscles in your core. So if you're not working on, and to be honest, I personally can testify to this because there was a time when I probably neglected, I'm human just like everybody. I wasn't doing as much core exercise as I should have been. And I kind of changed my swing a little bit to actually engage more of a downswing where I turn pretty hard on my downswing to rotate through the ball. And I started developing some back pain. And I've since really started working very significantly on developing and strengthening my core stability exercises, particularly my multifidus muscles, my side back muscles, and my core stomach muscles, and sports specifically training. So in other words, I took a band and actually started training the muscles, those 6 or 7 muscles that actually engage your downswing, and started actually strengthening them. And not just that, my glutes, my hip muscles. So I'm guessing what's happening with you is that your muscles in that golf swing are not actively engaging because they're weak. So the way to combat that, and it won't happen overnight, but if you start doing it, you'll actually see a huge difference, as I did. And it's doable. So my suggestion would be, you probably don't need a lot of advice or care, but probably going to see Caitlin, getting a referral to go to our physical therapy department, and them doing a very sports specific type of assessment towards golf, and then giving you a very sports specific exercise prescription, not only to do there for a couple visits, but then show you what to do at home on a regular basis. I know in my experience personally that made a difference, and I'm pretty sure it will with yours as well. Any further questions? Did I answer everybody's question, I hope? Well, I want to thank everybody. Nope, there's more. Sorry.
Yeah, we got one more.
Oh, so riding, that even goes more towards the golfer question. That even goes more towards your muscles are weak, and the muscles that are important. And if you're swinging properly, you really do need to engage your core. And equally important, engage your glutes. If you've ever watched Tiger Woods talk about when his swing gets messed up, he's not engaging his glutes properly. I'd be willing to bet you that if I were to do an exam on your glutes would be weak. So the pain that you're getting in your hip area is probably due to a combination of weak glute muscles, which are really important in stabilization of a golf swing, but also your core muscles, especially on the side as you're rotating into your downswing and making impact on the golf ball. How about that for a particularly precise answer? But now that you're telling me you're riding and not walking, I'm pretty sure that's what it is. Neck pain that's sharp, it shoots. She doesn't know why it occurs. Could it be arthritis? Well, it could be. I'm just looking at a question. I'm not going to ask you your age, but I'm guessing age is partially responsible. As we get older, I talked about how wear and tear can cause joint arthritis to set in. So if the joints have some arthritis in it, but equally important, if the muscles, and I don't know, maybe you do and maybe you don't, notice clicking in your neck as you move around, or some grinding as you start to rotate and move your neck around, just kind of type in yes or no on the clicking or grinding, because that'll kind of give me an indication of what's going on. But I'm going to assume the answer is periodically it does. It means that your neck is catching and that the muscles that support your neck are weaker. Probably posturally, if we were to take a look, your probably head is forward, which probably is contributing to some of that joint strain and some of that weakness of the muscles that support the neck muscles, the neck joints. So I'm guessing that because your neck muscles are weak, you probably have, in conjunction with some arthritis, you probably have, things that just regular activities of daily living that just precipitate your pain. So I would say yes, partially arthritis. But having said that, if I were to take 100 people off the street, your age, who had no neck pain whatsoever, and took x-rays of their necks, assuming you were about 50, and I'm making an assumption, I'm not saying you are, but assuming you're about 50, 65%, 60 to 65% of those people with no neck pain would have significant arthritis on the x-ray. So having arthritis, be in and of itself, is not the reason why people have neck pain. Could it be a contributing factor? The answer is yes, if it's coupled with inflammation in those joints due to weak muscles or due to joints that are out of alignment. So again, this goes back to doing a proper evaluation, a proper examination, getting some x-rays, putting the pieces of the puzzle together, and then making a diagnosis and then making a treatment plan. Again, this goes back to seeing a provider that knows how to put it all together. And I'm biased, Caitlin Conville, who I've worked with for years now and have personally trained, extremely competent in being that person. So if this is an issue that's truly bothering you, I'd recommend you go see her and make an appointment to see us.
Hey, Dr. Ben.
Oh yeah, pretty much on that what?
No,
Yeah.
I was just going to say the person who submitted that question
Yeah,
just
I just
provided
lowered
more
the cursor
detail.
when I see that. So the answer is yes. I think most likely it's mechanical and muscular, and pretty much my assumption was correct. Probably because it's degenerative in your age. Probably seeing a PT or a chiropractor would be very, very helpful because it's mechanical and muscular. There's probably muscle weakness and atrophy, and you probably have mechanical joint dysfunction. Again, seeing our nurse practitioner, I think, would be the right thing to do. And again, we take pretty much every insurance, and she would send you to the right person. And we call it a patient-centered approach. We would have a discussion with you, and you would tell us, we would tell you what's wrong after we did our investigation and exam and our pictures. And then we would decide together which is the best approach for you. Next question. I've been diagnosed with cervicogenic headaches. Would chiropractic help me with that? So cervicogenic headaches, the answer is most likely yes. However, we sometimes take a kind of a multidisciplinary approach to this. A chiropractor would certainly help because they would work on the joints, they would work on the muscles, break up the knots in the muscles. But if you had a significant amount of muscle spasm or trigger points, sometimes we would work with someone who would do some trigger point injections to actually break those knots up even sooner. And we would do that together with whether it's physical therapy or chiropractic. So the answer is yes. No clicking, and age-wise, yes, my answer doesn't change. Next question was, I'm 55 with degenerative disc disease in my back and neck. Would a PT or chiropractor help? And would it be, is it more mechanical? Assuming that, there's no pain down your arms or legs and no numbness and no weakness, and it's really just at your neck and back that you have pain, the answer is you're probably right. It's probably mechanical and muscular and probably maybe even a little bit of postural. And again, this goes to what I said before. Just because you have degenerative disc disease in your back, we could take 1,000 people off the street that are your age, and probably 65% of them will have an MRI or an X-ray that look just like yours. So being in and of itself, that's not the main reason. There's usually other reasons. So once we've identified it, and long story short, after we've done an investigation, yes, a PT or chiropractor is absolutely where we would start. And again, it's a patient-centered approach. We would have a discussion with you, lay out which one you think you would like to do better and make that recommendation. And our nurse practitioner, Caitlin, she would set the whole thing up for you. It would be covered by insurance as well. So great questions. Okay, and the person who already has been to us, I will personally handle that today. I have a phone conference with the center today and the staff, so I will handle that question about getting those answers regarding seeing a chiropractor for that one person who asked me that question. Okay, it was my pleasure to serve everybody today and teach you a little bit more about the myths, truths, and the falsehoods about what perpetuates back pain. Give you some ideas about what you can start doing. Your take-home message today regarding diet, posture, and exercise. And lastly, if you're having some issues, I'm very confident that the nurse practitioner in our program can help. I urge you to call our center. And for the person who has already been to our center, I will handle that after we hang up. Thank you very much.
Awesome.
All right, thank you very much for attending. Everybody enjoy your day and improve your lifestyle.
Thank you so much, Dr. Ben. And yeah, if anybody has any more questions for Dr. Ben, you can email them off at matherhospital@northwell.edu, and I'll send them your way. But thank you, everybody, for joining, and enjoy the rest of your day.